Hi, I'm Dr. Karen Stierman from the Ear, Nose, and Throat Center of Austin, and today we're going to talk about some frequent things that we see in the ENT clinic. One of the most frequent things that we see is a ear problem that patients will come in for, complaining of plugged ears or a plug feeling in their ears. This can happen quite frequently in adult patients as well as pediatric patients. And it has to do with a problem in the eustachian tube shown here on this diagram. If the eustachian tube opening experiences a little bit of swelling at the opening of the eustachian tube in the back of the nose, then what can happen is the ear can't equilibrate the pressure, and you can feel as if your hearing feels muffled and as if you don't hear as crisply as before. When that happens, usually we'll evaluate you in clinic, confirm the diagnosis through a exam history as well as some audiological testing. And once we establish the diagnosis, it's a very treatable condition, typically with topical allergy medications. The condition can also present with exercise because exercise increases blood flow to our body, and when a part of the body gets more blood flow, it can get congested, and it can mimic allergy-induced eustachian tube problems. Another very common problem that we see in the Ear, Nose, and Throat Center is a problem called swimmer's ear or otitis externa. When that condition occurs, typically there's swelling around the ear canal area here. And there's two main causes, one being bacterial-induced otitis externa or swimmer's ear, which is the classical form typically treated with eardrops topically. The other form is called fungal otitis externa. This is often a misdiagnosed problem in patients. Patients will come in having seen other physicians, possibly not specialists, and will examine their ears and find a fungus in the ear canal, and we're able to remove that safely and effectively in clinic, providing almost immediate relief. And then we usually advise some topical therapy, antifungal therapy, to prevent its recurrence. Prevention of swimmer's ear is usually done with either wearing earplugs when being exposed to the water, or with a simple ear rinse, which is usually half rubbing alcohol, half white vinegar mixed 1-to-1, and this can be applied topically in the ear canal after the end of the swimming day. If you have a history of a perforation in the eardrum or tubes prior surgery in the ear, then you should be cleared prior to using that medication. Another very common problem we see in the Ear, Nose, and Throat Center is tonsil issues. And the subject of tonsillectomy comes up for people who do not respond to maximal medical management for their tonsil issues. The tonsils, of course, are in the throat, typically seen here. Sometimes the tonsils can be so large that they can cause problems such as snoring or obstructive sleep apnea. This is a very common reason that we have to remove tonsils in children, typically providing relief of the snoring or sleep apnea condition. A frequent question that we get in the clinic is, does my child need a tonsillectomy if they're only snoring? I usually answer that question by assessing the severity of the snoring and the effect of the snoring on the quality of the sleep. If I feel there's significant effect and the child doesn't respond to allergy medications, then typically tonsillectomy is performed. Another indication would be chronic or recurrent infections, typically if someone gets 6 infections in 1 year or 3 to 4 infections a year for multiple years, then tonsillectomy is advised. One of the common questions we get from patients is tonsillectomy done more often or less often in this day and age than times before? And I think, and during my practice, which has been 10 years in Austin, the indications for tonsillectomy have remained the same, and thus the frequency in which I do the procedures have remained the same.